If you keep getting painful, hard bumps on the back of your head or neck that just won't go away, this video could genuinely change your life. These bumps have a name: Acne Keloidalis Nuchae, and millions of people, especially black men, are dealing with this condition right now without knowing what it is, why it keeps coming back, or how to stop it. Stay with me, because by the end of this video you'll know exactly what causes it, what makes it worse, and the proven steps to prevent it from progressing. Welcome back to the channel. Before we get into it, if this is your first time here, hit that subscribe button and turn on notifications so you never miss content like this. So what exactly is Acne Keloidalis Nuchae? Despite the name, it's not actually acne. AKN is a chronic inflammatory condition that affects the hair follicles at the back of the scalp and the nape of the neck. Over time, those inflamed follicles develop into firm, raised scars, similar to keloids, which is where the name comes from. It's most common in men of African descent between the ages of 13 and 25, but it can affect anyone, including women. And here's what makes it tricky. Most people don't take it seriously until it gets bad. By that point, the scarring can be permanent. The earlier you catch it and prevent it, the better your outcome. Now let's talk about what actually causes this condition and, more importantly, what you might be doing right now that's making it worse. When a barber cuts your hair extremely close to the nape of the neck, especially with clippers or a razor, it can irritate the follicles and cause ingrown hairs. This is probably the #1 trigger for most guys. Wearing tight helmet straps, shirt collars, or headbands that constantly rub the back of your neck creates repeated trauma to that skin. Over time, your body responds with scarring. If your hair has a tighter curl pattern, it's more likely to curve back into the skin after being cut, triggering that follicle inflammation. Excessive sweating, especially from working out, combined with not cleansing the scalp regularly, can clog follicles and worsen inflammation. This one is huge. When the bumps itch, and they will, scratching them introduces bacteria, deepens the inflammation, and accelerates scarring. Alright, here's what you actually came for. Let's talk prevention. These are the steps that dermatologists and skin specialists recommend. Talk to your barber, seriously. Tell them you're dealing with AKN or sensitive skin at the nape. Ask them to avoid shaving or tapering too close to the hairline at the back of your neck. A scissor cut or a higher fade that doesn't go all the way down is much safer for your follicles. And if your barber is using a razor on the back of your neck, stop that immediately. Use a gentle, fragrance-free cleanser on the back of your neck and scalp at least twice a week, more often if you sweat heavily. Look for cleansers with salicylic acid or benzoyl peroxide, which help keep follicles clear and reduce bacteria. Some people do well with a mild medicated shampoo used on the nape area as well. If you already see small bumps forming, this is where you act fast. Early-stage AKN can often be managed with over-the-counter treatments. Look for products containing, apply these consistently to the affected area as directed. Switch to loose-fitting shirts and avoid tight collar shirts that rub the back of your neck. If you wear a helmet for sports or work, make sure the strap isn't sitting directly on the nape. Even your pillowcase matters. Switch to satin or silk to reduce friction while you sleep. I know it's tempting, but every time you touch those bumps with your fingers, you're introducing bacteria and making the inflammation worse. Keep your hands away from the area. If it itches, apply a cold compress or use a soothing topical like aloe vera gel. This is the most important step most people skip. AKN is a progressive condition. It gets worse over time if left untreated. A dermatologist can prescribe stronger topical steroids, antibiotics, or even laser therapy to stop it in its tracks before permanent scarring sets in. Don't wait until it's a large keloid mass. Go early. If your AKN has already progressed, here are the clinical treatment options your dermatologist may recommend. Topical or injected corticosteroids help flatten raised bumps and reduce inflammation. Oral antibiotics like doxycycline are commonly prescribed to control the bacterial component. For more advanced cases, laser hair removal has shown strong results in reducing the follicle activity that drives AKN. In severe cases, surgical excision may be needed to remove large keloid plaques, though this requires careful aftercare to prevent recurrence. The good news is that with the right treatment plan, most people see significant improvement. Acne Keloidalis Nuchae is one of those conditions that's incredibly common in our community but barely talked about. The more awareness we spread, the earlier people can catch it and prevent the kind of permanent scarring that affects confidence and quality of life. If this video helped you, share it with someone who needs it. Drop your questions in the comments below and I'll do my best to answer them. And if you want to see more content on scalp health, hair care, and skin conditions that actually affect us, subscribe and let me know in the comments what topic you want me to cover next. Take care of your skin. I'll see you in the next